you guys requested a deep dive on headaches.
Ooh.
And it's a really fascinating topic.
Yeah, it is.
Because it kind of touches on so many different areas, like neurology and lifestyle factors, even psychology.
Okay.
It's not just about popping a pill when you get a headache.
No, it's way more than that.
There's so much more to it.
Right.
And I actually learned a lot.
Yeah, me too.
Doing the research for this episode.
It is interesting how many different types of headaches there are.
Yeah.
You know, it's not a one-size-fits-all situation.
Exactly.
And our sources for this deep dive broke it down into two main categories.
Okay.
Chronic recurring headaches and headaches that are caused by underlying medical conditions.
Oh, those were...
Which they call headaches due to pathology.
Headaches due to pathology.
Yes.
Okay, so chronic recurring headaches would be like the ones that most of us are familiar with.
Right.
Like tension headaches.
Yeah.
You know, the ones that come with stress?
Exactly.
Yeah.
Tension, headaches, migraines.
Yeah. Or those horrible migraines.
Those are like the usual suspects in that category. And then you have headaches due to pathology.
Right.
Now, those can be tricky.
Yeah.
Because they could be a sign of something else going on in your body.
So like
an infection, high blood pressure,
okay.
or even a problem with the brain itself.
Ooh, okay.
Like a subarachnoid hemorrhage or a brain tumor.
So that's like a major warning sign then?
Yes.
If you have a headache and it's new or it's really severe.
Yeah.
Or just different from your normal headache pattern.
Correct.
You need to go see a doctor.
Absolutely.
Yeah.
It's crucial to rule out any serious underlying causes.
Especially if it's like
Especially
with other symptoms.
Right. If it's accompanied by other symptoms like nausea or vomiting or any neurological changes.
Okay.
You know, one thing that really stood out to me in the research was this idea of a unilateral headache.
Unilateral.
Yeah, meaning it's always on one side.
Okay.
That never switches sides.
Oh, wow.
For like over a year.
Okay.
This could potentially indicate an occipital arteriovenous malformation, or AVM for short.
Occipital AVM, that sounds...
It's a mouthful.
It sounds pretty serious.
Yeah.
What is that?
Well, it's basically an abnormal connection between arteries and veins in the brain.
Okay.
Most people wouldn't associate that with headaches.
Right.
But it can be a red flag.
Oh, wow.
So it's always best to err on the side of caution and get checked out.
Yeah.
If anything seems unusual about your headaches.
Okay, so you mentioned migraines before.
Yes.
And I know those are something that a lot of people struggle with.
Yes, they...
What makes them so different from other types of headaches?
Well, migraines are interesting because they can be so varied in how they present.
Okay.
Back in 1962, a committee actually came up with a way to classify them into different categories.
Wow.
Common, classic, complicated, equivalent, hemiplegic,
all right,
and basilar artery.
That's a lot of categories.
It is.
It sounds like doctors really need to do some detective work.
They do.
To figure out.
It's like piecing together a puzzle.
What kind of migraine someone has.
Exactly.
Okay.
So imagine you're experiencing a headache, and you tell your doctor that you also see flashing lights.
Yeah.
Before the pain sets in.
Okay.
That visual disturbance, what's called an aura, is a key clue.
Okay.
And doctors often ask about a march of symptoms.
What does that mean?
Meaning, do the symptoms slowly spread?
Okay.
Or appear in a specific pattern?
Okay.
This helps distinguish classic migraine from other types.
So if those visual disturbances are like a slow wave moving across your vision, that would point to a classic migraine.
Exactly.
Okay.
And that march-like progression tells us something about what's happening in the brain.
Interesting.
During a classic migraine,
yeah,
it suggests a wave of electrical activity spreading across the cortex, which is the outer layer of the brain.
That's fascinating.
It is.
So what about these other migraine types?
Right.
What makes them unique?
Well, you have complicated migraine, which is essentially a classic migraine, but with longer-lasting neurological symptoms.
Ooh.
Sometimes these symptoms, like numbness or tingling, can persist even after the headache itself goes away.
Oh, wow.
Which can be quite alarming.
Yeah, that definitely sounds more intense.
It is.
Are any of the other types associated with specific symptoms like that?
Yes. Hemiplegic migraine, for instance,
is
unique because it involves temporary paralysis on one side of the body.
Oh, wow.
And what's unusual is that the paralysis can sometimes outlast the headache itself.
Oh, my gosh.
Which can be very frightening.
Yeah, I can imagine.
For the person experiencing it.
It sounds like these less common migraine types can really mimic other serious neurological problems.
They can.
Yeah.
Which is why it's so crucial to have a proper diagnosis
from a
healthcare professional.
Okay.
Now, basilar artery migraine is another interesting one.
Okay.
It primarily affects adolescents.
Okay.
And is characterized by a range of neurological symptoms related to the brainstem and cerebellum, which are supplied by the basilar artery.
Okay.
Think of the basilar artery like a major highway in the back of your brain.
I like that.
If there's a traffic jam there due to a migraine, it can disrupt all sorts of signals, leading to vertigo problems with coordination, even slurred speech.
So it's like a migraine that messes with your balance and coordination.
Exactly.
That sounds really disorienting.
It can be quite debilitating.
Wow.
But thankfully, these symptoms are usually temporary.
Okay.
And one more intriguing point about basilar artery migraine.
Okay.
Family history seems to play a significant role.
So if your parents or siblings have migraines,
yes,
you might be more likely to experience this type.
That's what the research suggests.
Wow.
Although more studies are always being done to understand the complex interplay of genetics and environmental factors in migraine development.
That's amazing how much we're still learning about the brain.
Right.
Okay, so before we get too deep into any more specifics about migraines, let's switch gears and talk about another type of headache that I know is particularly dreaded. Cluster headaches.
Ah, yes, cluster headaches. Those are definitely a unique and often misunderstood type of headache.
Yeah.
They are not true migraines.
Okay.
But a distinct neurovascular event.
So I remember when I first learned about cluster headaches. Yeah. I was just struck by how debilitating they can be. Imagine having such intense pain that some people consider
deep brain stimulation.
Deep brain stimulation.
Yeah.
Wow, that puts it into perspective.
Yeah.
How severe these headaches can be.
They're no joke.
Can you tell us a bit more about what causes them and what they feel like?
So cluster headaches are characterized by intense recurring pain.
Okay.
Usually focused around one eye or temple.
Okay.
They're often accompanied by what we call autonomic symptoms.
Okay.
Meaning they affect the involuntary nervous system.
Right.
So you might see a red, watery eye, what doctors call conjunctival injection.
Okay.
Nasal congestion, or even facial flushing.
Oh, wow.
On the same side as the headache.
So it's not just the pain?
No.
But all these other symptoms happen at the same time.
Exactly. It's like a whole cascade of neurological events.
Wow.
Happening all at once.
Yeah.
And it can be incredibly overwhelming for the person experiencing it.
Okay.
And here's another thing that makes cluster headaches unique.
All right.
They tend to occur in clusters.
That makes sense.
Hence the name.
Right.
You might have multiple headaches a day.
Wow.
For weeks or even months.
Okay.
Followed by a remission period.
Okay.
That typically lasts about a year.
So a whole year of remission?
Yeah.
That must feel like a huge relief after going through a cluster cycle.
Oh, absolutely.
But then the worry of it coming back must always be in the back of your mind.
That's a really insightful point.
Yeah.
It's this unpredictable nature of cluster headaches.
Right.
They can really take a toll on people's lives. They're constantly on edge, wondering when the next cycle will strike.
That sounds really tough.
It is.
It sounds like managing cluster headaches requires a very specific approach.
It does.
What are some of the treatment options available?
Well, treating cluster headaches can be quite challenging.
Okay.
But there are a few options that have shown some success.
Okay.
Oxygen therapy delivered through a face mask has been found to be effective in aborting cluster headache attacks.
Wow.
In some individuals.
Interesting.
There's also a class of medications called triptans.
Okay.
Which can be helpful for both migraines and cluster headaches.
Okay.
But they often need to be administered in a different way for cluster headaches, such as through an injection or a nasal spray to be effective.
Okay.
And then for those who don't respond to these more conventional treatments, there are more invasive options, like nerve blocks or even that deep brain stimulation we discussed earlier as a last resort.
So it sounds like treating cluster headaches can be quite a journey.
It can be.
With a lot of trial and error to find what works best for each individual.
Absolutely. But the good news is that medical advancements are constantly being made.
Right.
And researchers are working hard to develop new and more effective treatments.
That's good.
For all types of headaches, including cluster headaches. So there is hope for those who are struggling with this particularly challenging condition.
Yeah, it really does sound like it. It's amazing how each type of headache seems to have its own unique set of challenges.
Right.
But thinking about all these different types and causes has got me curious about what triggers them in the first place. What are some of the things that can set off these headache episodes?
Well, it's really a complex interplay of factors.
Okay.
But our sources do highlight some common culprits.
Okay.
Especially when it comes to migraines.
Okay.
Stress seems to be a big one for a lot of people.
I can definitely relate to that.
Yeah.
Stress headaches are all too familiar.
Right. It's like your body's way of saying, hey, we need to slow down and take a break.
Yeah, for sure.
Right.
But what about those triggers that aren't as obvious?
Yeah.
Are there things that people might not even realize
Absolutely
could be contributing to their headaches?
Diet is a big one.
Okay.
Things like caffeine withdrawal.
Okay.
Alcohol. And certain foods like aged cheese or processed meats.
Oh, really?
Can be common triggers for some people.
Wow.
It's fascinating how something you eat
Yeah.
can have such a direct impact on your brain chemistry.
It really shows how interconnected our bodies are.
It is amazing.
If someone is trying to pinpoint their headache triggers, it might be worth taking a look at their diet.
Right.
Seeing if there are any patterns there.
Absolutely.
But I imagine it's not just about the things we consume.
No, it's not.
Right? Our lifestyles play a role, too?
You're exactly right. Changes in sleep patterns.
Okay.
Whether you're getting too much or not enough sleep.
Oh, wow.
Can be a trigger for some hormonal fluctuations, particularly in women, can also play a role. It's why some women experience migraines around their menstrual cycle.
Right.
And believe it or not, even changes in the weather.
Really?
Like barometric pressure fluctuations can be a headache trigger.
Wow. So headaches really can be influenced by so many different things.
They can.
It's like our bodies are sending us signals trying to tell us something is off.
That's a great way to think about it. Headaches are often our body's way of communicating that something needs attention.
Okay.
It could be a sign of stress.
Right.
An imbalance in our diet. Or as we discussed earlier, even an underlying medical condition that requires further investigation.
It makes you realize how important it is to really listen to those signals.
Yeah.
And not just try to mask the pain with medication.
Right.
Speaking of which, let's talk about treatments.
Okay.
Knowing what we now know about all these different types of headaches, are there specific approaches for each?
Absolutely. Treatment strategies are very much tailored to the specific type of headache you're dealing with.
Okay.
For those common tension headaches, over-the-counter pain relievers like ibuprofen or acetaminophen can often provide relief.
Okay.
Relaxation techniques like massage or meditation can also be helpful in reducing muscle tension.
Those are the go-to remedies for many of us when a tension headache strikes.
Sure.
But what about for migraines?
Yeah.
Are over-the-counter medications enough?
For migraines, the approach can be a bit more complex.
Okay.
Over-the-counter pain relievers might help with mild migraines, but for moderate to severe cases, prescription medications are often necessary.
Okay.
There are several classes of drugs specifically designed for migraine treatment.
Okay.
Including triptans, which target serotonin receptors in the brain, and ergotamines, which constrict blood vessels.
Okay.
In some cases, preventative medications,
Right.
like beta blockers or antidepressants, might be prescribed to reduce the frequency and severity of migraines.
So it's not a one-size-fits-all approach?
No.
It sounds like finding the right treatment for migraines often involves working closely with a healthcare provider to figure out what works best.
Exactly. It's a personalized approach.
Right.
What works for one person might not work for another.
For sure.
It often takes some trial and error to find the most effective treatment strategy.
That makes sense. And what about those cluster headaches we talked about earlier?
Right.
I remember you mentioned some pretty intense treatments.
Yeah.
Like oxygen therapy and even deep brain stimulation.
Yes. Cluster headaches are particularly challenging to treat.
Okay.
Oxygen therapy delivered through a face mask has been shown to be effective in aborting cluster headache attacks in some individuals.
Right.
Triptans can also be helpful, but as we discussed, they often need to be administered in a different way for cluster headaches, such as through an injection or a nasal spray.
Okay.
And for those who don't respond to these treatments,
Yeah.
more invasive options like nerve blocks or even deep brain stimulation might be considered as a last resort.
It sounds like treating cluster headaches can be quite a journey.
It can be a long road, but it's important to remember that there's always hope.
That's good to hear.
Medical advancements are constantly being made, and researchers are working hard to develop new and more effective treatments for all types of headaches.
That's reassuring to hear.
Yes.
And I think it's important to emphasize that no one should suffer in silence.
I agree.
If you're experiencing frequent or debilitating headaches, Yeah.
Don't hesitate to reach out to a healthcare professional for help.
I couldn't agree more. There's no need to tough it out on your own.
Mm-hmm.
Seeking professional help is the first step towards understanding your headaches.
Right.
And finding the right treatment plan to manage them effectively.
Well said. You know, all this talk about triggers and treatments has me thinking.
Yeah.
What about those headaches that aren't necessarily migraines or cluster headaches?
Sure.
What about those headaches that seem to come out of nowhere, or those that linger for days or even weeks?
That's a great question, and it leads us back to those headaches that are caused by underlying medical conditions.
Right.
What our sources refer to as headaches due to pathology.
Right. We touched on that earlier.
We did.
But I'm ready to dive a little deeper.
Okay.
This sounds like it could get pretty serious.
It can be. Remember those two main categories of headaches we talked about?
Mm-hmm.
Chronic recurring headaches and headaches due to pathology.
Well, the latter category encompasses a wide range of potential causes.
Okay.
And some of them can be quite serious.
Can you give us some examples?
Sure.
What kind of medical conditions can cause headaches?
Well, as we mentioned before, certain brain conditions, like a subarachnoid hemorrhage, which is bleeding in the space surrounding the brain.
Oh, wow.
Or a brain tumor can cause headaches.
Right.
But headaches can also be a symptom of systemic illnesses, meaning illnesses that affect the whole body, like infections, high blood pressure, or even problems with your sinuses.
So it's not always just about what's going on in your head.
Right.
It could be a sign of something happening elsewhere in the body.
Precisely. And that's why it's so important to seek medical attention.
Yeah.
If you're experiencing headaches that are new, severe, or different from your usual headache pattern,
a
healthcare professional can help determine whether your headache is a standalone issue or a symptom of something more serious.
This is definitely a lot to process, but I think it's incredibly valuable information for anyone who's ever experienced a headache.
It is.
Which is pretty much everyone.
Pretty much.
Right.
Absolutely. Understanding the different types of headaches, their potential triggers, and the importance of seeking medical attention when necessary can empower us to take control of our headache experience and seek the right treatment to improve our quality of life.
Well said.
Thank you.
You know, as we wrap up this deep dive, I'm struck by the sheer complexity of headaches. It's not just about popping a pain reliever. It's about understanding our bodies.
Yes.
Recognizing the signals they're sending us and advocating for our own health.
I couldn't agree. More headaches are often a multifaceted puzzle. And solving that puzzle requires knowledge awareness.
Right.
And a willingness to seek professional guidance when needed.
We've covered so much ground today, but there's one more aspect I want to touch on before we conclude this deep dive. It's the emotional and psychological impact of headaches.
Yeah, that's an important one.
It's easy to get caught up in the physical aspects of headaches,
Right,
the pain, the symptoms, the treatments, but we can't overlook the emotional and psychological toll they can take.
Absolutely. Chronic headaches, especially those like migraines or cluster headaches, can really wear a person down.
Yeah.
The unpredictability, the intensity of the pain, the disruption to daily life.
Right.
It can all lead to feelings of anxiety, stress, even depression.
I can imagine. It's hard to feel like yourself.
It is.
When you're constantly battling headaches.
It really is.
It's almost like the fear of the headache becomes as debilitating as the headache itself.
Right. You're always on edge waiting for the next one to hit.
Exactly.
Yeah, and there's actually a term for that.
Really?
It's called cephalgiaphobia.
Cephalgiaphobia.
Yes. The fear of headaches.
Wow, I've never heard that before.
Yeah. And for some people, it can become so debilitating.
Oh, wow.
That they avoid activities they once enjoyed, withdraw from social situations, and even experience panic attacks.
So the fear of the headache is actually triggering more headaches.
Exactly. It becomes a vicious cycle.
Wow.
The fear of headaches actually triggers more headaches, further reinforcing the anxiety.
That sounds really tough to deal with.
It is.
It makes you realize that treating headaches isn't just about addressing the physical pain.
No, it's not.
It's about supporting the person's emotional well-being, too.
Exactly. It's about treating the whole person, not just the headache.
Right.
There are therapies like cognitive behavioral therapy that could be incredibly helpful in managing headache-related anxiety and developing coping mechanisms and relaxation techniques like meditation or deep breathing exercises can also be beneficial in reducing stress and promoting a sense of calm.
So it's about giving people the tools to manage not just the pain,
Yes.
but also the emotional impact headaches can have on their lives.
Precisely. It's about fostering a sense of control and resilience
Okay.
in the face of chronic headaches.
Yeah.
And it's also about remembering that no one has to go through this alone.
Right.
Seeking support, whether it's from healthcare professionals, support groups, or loved ones, is crucial.
This has been such an eye-opening deep dive.
It has.
I feel like I've gained a whole new understanding of headaches,
Good.
the different types, the potential triggers, the treatment options, and the profound impact they can have on our lives, physically and emotionally.
It's been a pleasure exploring this fascinating topic with you.
Yeah, this was great.
And I hope you, dear listener, have gained valuable insights as well.
Yeah, I hope so too.
Remember, knowledge is power when it comes to managing headaches. Understanding your specific type of headache, recognizing your triggers, and working with healthcare professionals to develop a personalized treatment plan are essential steps toward improving your quality of life.
And don't forget the importance of self-care stress management.
Yes.
And seeking support when you need it.
Absolutely.
Headaches might be a common experience, but they don't have to rule your life.
Well said. Now, as we conclude our deep dive, I want to leave you with a thought-provoking question to ponder.
Hit me.
Considering the wide range of headache triggers we've discussed, from stress and diet to trauma and even genetics, what factors might be influencing your personal experience with headaches?
That's a great question for all of us to reflect on.
Yes, it is.
Perhaps this deep dive has sparked some insights into your own headache journey.
I hope so.
Maybe you've identified some potential triggers you weren't aware of before.
Right.
Or perhaps you're feeling inspired to seek professional help to manage your headaches more effectively.
That's great.
Whatever your takeaway, remember that knowledge is power.
Yes, it is.
And you have the ability to take control of your headache experience.
Absolutely. Thank you for joining us on this journey of discovery.
This was fun. I learned a lot.
Until next time, stay curious, stay informed, and stay well